Hi there, this is Dr. Ma'in Hasib, the Accreditation Consultant and Quality and Safety Trainer in Clinical Laboratories with Lesson 1 and the topic of Waste Management Clinical Laboratories, and we're going to be starting to talk about biomedical waste management in clinical laboratories. In Lesson 1, okay, we'll talk about an introduction. We'll give you an introduction to the topic. Then we'll cover biomedical waste classification. Then the magnitude of the BMW. Okay. Who generate BMW? Biomedical waste. Okay. When did the concern about BMW started? Why do you need BMW management? What are the problems associated with BMW? Who is at risk of infection? What are the routes of transmissions? That's in lesson 1. In lesson 2, we'll continue with the subject and we'll talk about the biomedical waste management steps. And under that, these steps that will be discussed will enlace in investments, assigning responsibilities, policies and procedures, survey of the waste generated, waste generation, waste segregation and labeling, waste collection and storage, and waste transportation. And we'll talk about in-house waste transportation and off-site waste transportation. In lesson 3, we'll continue with the waste management clinical laboratory biomedical waste management steps, and we'll talk about waste treatment and disposal. In lesson 4, we'll talk about the do's and don'ts of biomedical waste management. Then we'll discuss biomedical waste management action plan. And then we'll talk about waste minimization. And under that, we'll give you a definition and the difference between waste management and waste minimization. Why we should minimize waste, how to minimize waste, and the 3 R's of waste reduction, then a subject summary. So let's start with lesson 1. Biomedical waste, any kind of waste generated from biological and medical sources and activities containing infectious or potentially infectious materials, whether solid or liquid, which may present a threat of infection to humans like AIDS and hepatitis. Example of biomedical waste: non-liquid human tissue, body parts, contaminated or infected laboratory waste, disposable sharp, microbiology cultures, body fluids, blood products, okay? All these. When we talk about biomedical waste, we talk about this stuff. Waste management, on the other hand, is the precise name of generation, collection, storage, transportation, treatment, disposal, or recycling and monitoring of waste. It is done to avoid the waste adverse effect over human health and environment. There are various types of solid waste, including municipal, agriculture, and special waste like healthcare waste. The biohazard disposal containers, and you will find this in the LabGen 77900. All infectious waste, okay, and other solid or liquid waste or refuse are discarded into biohazard labeled container that do not leak and have solid, tight-fitting covers that are applied before transport from the laboratory work area for storage and disposal. All infectious waste must be incinerated or appropriately decontaminated before being sent to a sanitary landfill. Do not pour biohazard material down the drain or in with normal waste unless authorized to do so. Stool and urine waste may be discarded into the sanitary sewage system. I have a video for you here on the management of biomedical waste, and it's from the state of Florida. State of Florida in America is one of the most regulated state about biomedical waste. And the reason for that, because they found in the 80s, they found lots of syringes and needles on the beaches. Okay, as I will mention the story later on in one of the lessons on safety.
Under Rule 64E-16 of the Florida Administrative Code, biomedical waste is defined as any solid or liquid which may present a threat of infection to humans. Some examples are non-liquid tissue and body parts from humans and other primates, laboratory waste, blood and blood products, body fluids or materials saturated with blood or blood products, and discarded sharps. All healthcare workers should take precaution to prevent injuries which may be caused by sharps.
Sharps are defined as materials that are capable of puncturing, lacerating, or otherwise penetrating the skin. And because there is this danger of puncturing the skin or penetrating the skin layer, they need to be put into an approved sharps container.
Needles and syringes with needles attached, and contaminated hard plastic or glass objects that are broken are just some examples of sharps. Absorbent materials saturated with blood, body fluids, or excretions or secretions contaminated with blood are biomedical waste. Absorbent materials saturated with blood or blood products that have dried, such as this gauze with dried blood from a surgical wound inside this young boy's ankle cast, are also included.
Your gauze, your Band-Aid, your cotton ball is a type of absorbent material that under the definition of the code would have to be saturated to be defined as biomedical waste.
The code also includes as biomedical waste non-absorbent disposable devices, such as this disposable plastic surgical drape being taken down by the nurse, that have been contaminated with blood, body fluids, or blood-contaminated secretions or excretions, and have not been sterilized or disinfected by an approved method.
A non-absorbent device would be a pair of gloves, an IV tube, a urine specimen cup, if there was to have the secretions with the blood in it, etc.
Biomedical waste must be segregated from other solid waste and placed into either a red bag or sharps container before it leaves the point of origin. The point of origin for biomedical waste is defined as the room, area, or location where biomedical waste is actually produced. Some generators get confused here and think that they can carry uncontained biomedical waste out of the point of origin and to a red bag or sharps container elsewhere. Proper containment of biomedical waste at the point of origin reduces the risk of exposure.
Every sharp needs to be contained in an approved sharps container at the point of origin. If the generator decides not to wall mount a sharps container or put a sharps container on the counter to leave in the room, then he or she may carry the sharps container into the room, place the used syringe and needle into the sharps container, and then carry it out with them.
In this example, the supervisor asked the environmental services employee not to put a red bag on a trash cart along with the regular solid waste. She is taking extra precaution because she is aware that if the two are mixed, and there is a leaking or ruptured red bag, the entire waste load is contaminated and must then be managed as biomedical waste. With the exception of sharps, biomedical waste must be packaged in impermeable red polyethylene or polypropylene bags like the one with these IV tubes and other biomedical waste are being placed in. Each bag is to be constructed of polychlorinated-free filler plastics. The bag must meet rigorous impact and tearing resistance standards to reduce the likelihood of rupture or tearing during handling. Sharps must be segregated from all other waste and put directly into a sharps container. Sharps containers must be designed primarily for the containment of sharps. Sharps containers must be leak-resistant, rigid, and puncture-resistant. They must bear the appropriate phrase and the International Biological Hazard symbol. It is extremely important not to overfill a sharps container.
A sharps container, generally the plastic sharps container, have a designated fill line. The reason for that is to minimize employee exposure and the chances of being stuck from needles or other types of sharps coming out of the container itself.
Pressed fiberboard sharps containers must also meet the above standards. Contaminated glass and plasticware that are broken may, at the discretion of the generator, be placed in a double-walled corrugated or solid fiberboard sharps container. However, needles and scalpel blades are prohibited from being placed directly into double-walled corrugated or solid fiberboard sharps containers. Biomedical waste can be stored at the generating facility for a period of up to 30 days. The 30-day time period starts when the first non-sharps item of biomedical waste is placed in a red bag or sharps container, or when a sharps container with only sharps is full or closed. All indoor biomedical waste storage areas should be restricted. What does restricted mean?
Under the definition of restricted, that can either fall under 1, locked at all times, 2, a sign designating the restriction, or 3, just the location itself. The easiest way to satisfy this requirement of the code is to put some sign on the door, whether it be authorized access, employees only, designating the restriction.
The storage area should be constructed of smooth and easy-to-clean materials, and the reason for this is
so that if there is a biomedical waste spill, and out of all the places for biomedical waste spill, this is the highest probability of having a spill because you're bringing all of your waste to the storage area. So you need to have it easily cleanable or disinfected if there were to be a spill. Therefore, you cannot have carpeting in the area, and even if it is constructed of cement, you need to make sure the cement is sealed because cement itself is porous.
Outdoor storage areas and containers are to be conspicuously marked with the International Biological Hazard symbol and must be secured against vandalism and unauthorized entry. Because an outdoor storage area is more easily accessible to the general public as opposed to indoor storage areas, the presence of the symbol and security mechanism are required.
So, as we know, WHO classified the waste in healthcare facilities to 9 categories. Okay, in the laboratories, you're gonna end up from these categories. Basically, in many labs, in most labs, either you're gonna have a chemical waste or the rest of this waste, okay, or general waste. Okay, you're gonna end up either with general waste, which can be trash normally. I mean, no big deal there, but we are concerned about the infectious waste, okay, or the biohazard waste. So you're going to end up either with the chemical waste, which we talked about, okay, in the lesson on the how to handle chemical waste. You can go back to that or refer to that. Or you're going to end up with biomedical waste under number 2, number 3, number 4, and maybe even number 5, okay, or 8 and 9. Only very tiny, small number of labs who could have radioactive waste. So Again, according to WHO, World Health Organization, 85% of the waste generated in healthcare facilities are non-hazard, general waste, category 1. Okay? And 15% of the waste generated is infectious waste and non-infectious, but hazards like chemical, pharmaceutical, radioactive. But what happens if we mix this 15% with the 85%? Then 100% need to be treated. 100% will be contaminated and need to be dealt with as contaminated and then need to be treated. That's why it's very important to separate general waste from infectious waste. Now, out of this 15% infectious waste and non-infectious but hazard waste, 10% is pathological and infectious waste, 1% is sharp waste, 3% is chemicals, pharmaceutical waste, and less than 1% is special waste such as the radioactive waste. However, this percentage may be higher or lower depending on the type of hospital or healthcare facilities and or even the country. So as you can see, this is the health care waste, 75 to 90% non-infectious waste and 10 to 25% clinical waste, which include all these categories. Again, this is another classification for the biomedical waste. So it could be 85 non-infectious, 10% infectious, and 5% hazard, which the 10 and the 5 can be grouped together. Also, for hospital waste, non-infectious could be biodegradable or non-biodegradable. The infectious waste be non-sharp or sharp. The non-sharp could be solid or liquid. The solid could be inserable or non-inserable, need autoclaving or microwaving, as we will talk about later on. What is a biodegradable waste? It can be degraded, okay, like paper, wood, fruits, and others. Non-biodegradable waste cannot be degraded, like plastic bottles, old machines, cans, and cups, styrofoam containers and cups. What is the magnitude of the BMW? It is a global international issue problem. In developing countries, they generate 1 to 2 kilograms per patient per day of waste. Only 57% of waste undergo proper disposal. In developing countries, they generate 1 to 5 kilograms per patient per day. Okay, and to give you some ideas about when we talking about 1 kilo generated per patient per day, to give you an idea about these numbers, 4 million pounds, 1.8 million kilos of plastic pipette tip are added to landfills every year. Americans alone are responsible for producing more than 220 million tons of waste a year. Some of these information, like general information, just to get an idea about the amount of waste generated by us, by people. It is estimated that food wasted by the US and Europe could feed the world 3 times over. 1/3 of the food is wasted in Saudi Arabia. For every ton of food waste prevented has the potential to save 4.2 tons of CO2 equivalent. If we all stop wasting food that could have been eaten, the CO2 impact would be the equivalent of taking 1 out of 4 cars off the road. So next, we're going to talk about who generates BMW. Healthcare facilities like hospitals, research facilities, laboratories, nursing homes, Autopsy centers, minor sources come from clinic, dental clinic, home care, cosmetic clinic, paramedics, and funeral services. Why did the concern about biomedical waste started? The public concern with the BMW dated back to the late 1980s, when large quantities of syringes and needles were found on the beaches in East Coast Florida in the US. About the same time, the HIV/AIDS epidemic started. So this led to the formation of the US Medical Waste Tracking Act, which came into force in November 1988. And why do we need BMW management? To prevent nosocomial infections, to control misutilization of leftover drugs, minimize the risk of air, water, and soil pollution directly due to waste or due to defective incineration, emission, and ashes. Check the risk of infection outside hospital for waste handlers and other people. I have another video for you on the waste of biomedical waste classification here that you can watch.
In this video, we shall learn about biomedical waste segregation and its disposal. Waste is generated by healthcare activities and includes a broad range of materials. These are used needle and syringes, soiled dressings, body parts, diagnostic samples, blood, chemicals, pharmaceuticals, medical devices, and radioactive materials. Proper disposal of waste is important to protect the healthcare workers, the patients, and to keep our environment clean. It is important to segregate the medical waste materials at the point of generation, treat them appropriately, and then dispose them off safely. The World Health Organization has classified medical wastes into 8 main categories. They are general waste, pathological waste, radioactive waste, chemical waste, infectious to potentially infectious waste, sharps, pharmaceuticals, and last but not the least, pressurized containers. All health professionals should be well conversant with their local hospital policies for waste disposal, which may vary from one place to the other. Commonly, there is a color coding for disposal of biomedical wastes. Drums with black, blue, and yellow polythene bags are used to segregate different types of wastes, each one of which has to be disposed of in a different way. Some hospitals use 4-colored bags for waste disposal. We have to refer to individual hospital policy regarding the waste disposal in these scenarios. The black bag is used for collecting dry waste material which is not infectious. The items to be included are the leftover food, fruits, feeds, vegetables, waste paper, packing material, empty box, bags and wrappers of cannulae. This waste is disposed of by the routine municipal council committee machinery. On the other hand, yellow bag is used for infectious but non-plastic waste. This includes blood-stained cotton, blood, body fluids, placenta, etc. This type of waste requires incineration. The items to be disposed of in the blue bag include all the infected plastic waste, just as disposable syringes, the intravenous set, the blood transfusion set, the endotracheal tube, urinary catheter, urine bag, medication vials are to be disposed of in the blue bag. The IV set, the blood transfusion set, the endotracheal tube, the catheter and the urine bag should be first cut into pieces and disposed of in the blue bag. Needles after destroying in the needle destroyer, used sharps, IV cannulae, blade and broken glass should be discarded in a puncture-proof container before disposing it off in the blue bag. Biomedical waste is also collected in the blue bag. The biomedical waste should be autoclaved to make it non-infectious. This is then shredded and disposed of. What are the benefits of biomedical waste management? The surroundings are cleaner and they are healthier. There is a reduction in the incidence of hospital-acquired and general infections. There is a reduction in the cost of infection control within the hospital. It also reduces the possibility of disease and death due to reuse and repackaging of infectious disposables. The incidence of community and occupational health hazards decreases to a considerable extent. The cost of waste management and the generation of revenue through appropriate treatment and disposal of waste is also reduced. Last but not the least, it improves the image of healthcare establishment and increases the quality of life. Thank you.
What are the problems associated with BMW? AIDS, hepatitis, herpes, viruses, bacterial infection, low birth weight, cancer, many other things. Multiplication of insect rodents, okay, environment pollution, okay, like effects on aquatic life, like fish. Change in regional climate could alter forest, crops, yield, and water supplies. Deserts, expansion, unpleasant smell. All these things are problems associated with BMW. So we have a hospital, okay, they generate the waste, okay, trash goes out, okay, then people come and play and come in contact with it, they get sick, infected, and they go back to the hospital. This is what happens if we don't manage the waste properly. Who is at risk of infection? We have sanitation worker, medical pharmaceutical staff, and patient. And the main group at risk include doctor, nurses, healthcare workers, patient, visitor workers, and workers in support services like the laundry, sanitation workers, etc. Okay, almost anybody who's working in a hospital is at risk of getting infection. So who has to give you an idea about the magnitude of the issue and the number of people get infected who work in healthcare? Who has estimated that in the year 2000? And I tried to get updated statistics I couldn't find from who. So in 2000 they estimated that in the year 2000 injection with contaminated syringes caused 21 million hepatitis B virus infection. That's 32% of all new infections. 2 million hepatitis C virus infections. That's 40% of all new infections. 260,000 HIV infections. That's 5% of all new infections. Also, according to the CDC in March 2000, it was estimated that 600,000 to 800,000 needle stick and other sharp injuries occur only annually among healthcare workers. Just FYI, okay, how much blood does it take to get infected with HIV and hepatitis, HPV. At least 0.1 ml of blood is required to cause HIV infection, and 0.00004 ml is required to cause HPV infection as a result of needle stick injury. So what are the routes of transmission for an infection? Okay, either you're gonna through the mouth, through the nose, or through the skin. That's how you're gonna get. These are the routes. Either you're gonna drink it, eat it, inhale it, or through the skin. I am done with lesson 1 on biomedical waste management in clinical laboratories. To continue with the subject, please go to lesson 2. And in lesson 2, we'll talk about biomedical waste management steps, which are the willingness, investment, assign responsibilities, policies and procedures, survey of waste generated, waste generation, waste segregation and labeling, waste collection and storage, waste transportation in-house and off-site. Thank you very much for watching.